as we said, the forearm is the part of the upper limb that lies between the elbow joint and the wrist joint. So this is the forearm. The forearm is divided into anterior, which is bulkier, mainly for flexor. It's called the flexor compartment, and a posterior extensor compartment. Our first station will be about the superficial muscles of the flexors compartment. It contains 5 muscles. They have a common origin, which is here from the medial epicondyle of the humerus. Okay, they are all innervated by the branches of the median nerve, except the most medial one, which is the flexor Carbi ulnaris. Regarding the component of the superficial flexors, if we place our forearm, if we place the heel of the opposite hand in the medial epicondyle and extended our fingers, the fingers will lie in a direction similar to the muscles. The thumb will be above the Pronator Thiris muscle. The index will be on Flexor Carbi Radialis. The middle will be on Flexor Digitorum Superficialis. The ring will be on Palmaris Longus, and the little finger will be on Flexor Carbi ulnaris. Now, let's see our muscles again. This is the Pronator Thiris muscle. This is Flexor. This is Flexor Carbi Radialis muscle. This is Flexor Digitorum Superficialis, and this is the tendon of Palmaris Longus, and this is the Flexor Carbi ulnaris muscle. We will talk about each one of them individually. Okay. The Pronator Thiris has got 2 heads of origin. This one is the superficial head, originate from the common flexor origin, which is the medial epicondyle, and a deeper head that originate from the coronoid process of the ulna. All right. The Pronator Thiris is inserted into the middle of the lateral aspect of the shaft of the radius. So it is from the medial epicondyle to the lateral aspect of the middle shaft of the radius. As the name implies, pronator, so the action is pronation of the forearm, and it is also a weak flexor of the elbow joint. Regarding important relationship in the Pronator Thiris, the median nerve enters the forearm between the superficial and the deep head. Okay, it also forms the medial boundary of this fossa, the cubital fossa. Okay, this is our first muscle, which is the Pronator Thiris. It is, as we said, innervated by a branch from the median nerve. Our second muscle is this one. Okay, this one is called Flexor Carbi Radialis. It originates from the common flexor origin in the medial epicondyle and inserted into the base of the second and the third metatarsal bones. Okay. It is supplied by a branch from the median nerve. Regarding its action, it is a primary flexion of the wrist, and it also causes abduction of the wrist. Okay. If we pull the muscle, it will cause flexion and slightly abduction of the wrist joint. Okay. Okay. Regarding our third muscle, which is this one. This one is called the Flexor Digitorum Superficialis. The Flexor Digitorum Superficialis again arises in two heads. The first head arises from the common flexor origin, which is the humerus, medial epicondyle of the humerus, and from the ulna, called the humero-ulnar head. The other head arises from the radius. So it has got two heads. One is humero-ulnar head, and the other one is the radial head. Okay. It continues as a fleshy part until the midpoint of the forearm. Then it forms into tendon. The tendon then gives 4 slips, one for each finger of the 4 medial fingers. Okay. Regarding the insertion of the tendons, we will see them in the next practical in the hand, but we should know that it is attached into the base of the proximal phalanx of the medial 4 fingers. Regarding relationships, the Flexor Digitorum Superficialis anterior to the median nerve. Okay, this is the median nerve. So it has got an anterior relation with the median nerve. Regarding the arrangement of the tendons in this area is called the flexor retinaculum. The arrangement of the 4 tendons is as follows. The tendons of the ring and the middle finger lies anterior to the index and the little finger. So in the area of the flexor retinaculum, this is the arrangement of the 4 tendons. Okay. Regarding the action of this muscle, Flexor Digitorum Superficialis, it is a flexor of the proximal interphalangeal joint and also flexor of the wrist and flexor of the metacarbophalangeal joint. So it flexes the proximal interphalangeal joint, flexes the metacarbophalangeal joint, and weak flexor of the wrist joint. Okay. Our next muscle, which is this one, it is called Palmaris Longus. Palmaris Longus is an inconstant muscle. It is absent in 13% of the population. Its tendon passes anterior to the flexor retinaculum to be attached to the palmar aponeurosis of the hand. The action of Palmaris Longus again is flexion of the wrist joint, and being attached to the palmar aponeurosis, it anchors the skin and the fascia of the hand. So if there is a force, shearing force on the palm of the hand, the Palmaris longus prevent damage of the skin and the fascia. Okay, so this is palmaris longus muscle. Our last muscle in the superficial flexor compartment is this one. It is called flexor carbi ulnaris muscle. The flexor carbi ulnaris muscle again arises from the common flexor origin here in the medial epicondyle, and it is attached distally into the bisiform trapezoid and the base of the first metatarsal of the fifth metatarsal of the fifth metacarpal. Okay, to the bisiform hamate and fifth metacarpal. The tendon of the flexor carbi ulnaris is immediately related to the ulnar nerve and vessel. Okay, it is medial to the ulnar nerve and vessels. This is the relation. Okay, as we said, all the flexor, the superficial flexor compartment are supplied by branches of the medial nerve, with the exception of the flexor carbi ulnaris, which is supplied by a branch from the ulnar nerve, which immediately below it. Okay, it is action. The flexor carbi ulnaris is again flexion of the wrist and ulnar deviation of the hand. Okay, flexion and ulnar deviation. Okay, that is all for the superficial muscles of the flexors compartment. Let's say them again. This is Pronator Thiris. This is flexor Carbi Radialis. This is flexor Digitorum Superficialis. This is Palmaris Longus and its tendon, and this is flexor Carbi ulnaris. Let's move for the next station.